for coming. We are glad that you're here today with us for our WifeSavers special guest live webinar with women around the world today. So my name is Emily Belknap, and I'm just going to kick things off here with our introduction. I would really love to introduce to you the lady, Ramona Zabriskie, who is
the lady
hosting the webinar. I keep calling her the lady Ramona. She's our lovely host today. And for those of you who might be with us because you know Corinne, or you've heard of her work and are not as familiar with Ramona, she's actually an award-winning author, mentor, and global educator of women around the world. She works with women in, I think, over 70 countries. She has a US-based team and an international team, and she mentors women in many different places. So we're glad to be with Ramona today. If you aren't familiar with her work, she has an amazing free podcast that's available, the WifeSavers podcast that she does with her charming husband, Dale. And you can find that on any podcast platform. She also wrote the life-changing book, Wife for Life, The Power to Succeed in Marriage. And you can find that on Amazon. And her course that's based on that book, but just blows it out of the water with 100 lessons, is WifeSavers. And you can find that on wifesavers.org. We also have today with us, with her beautiful yellow background, founder and CEO of Know Your Lemons, Corrine Ellsworth-Beaumont. And we're so excited to get to know her a little bit better today. She, as you know from our announcement, she has her doctorate in design thinking and is the founder of the Know Your Lemons Foundation. Her charity's mission is to improve early detection of breast cancer worldwide through creative and inclusion education, which is what she's going to be doing with us today, is educating us on this topic. She's made appearances on BBC Breakfast and has a Know Your Lemons campaign, which has at least 1 billion followers, which is really awesome. They also have a Know Your Lemons app. And so we really encourage you to get that if you haven't done that yet. I think Corinne is going to be giving us a sneak peek into their website during the presentation today. So that's going to be really fun. And I have a feeling we are really going to learn a lot today from Corinne. So I think we're in for a treat with her. Just to give you a little information, I think most of us in the world today are very familiar with the Zoom environment, but in case you're not, let me explain to you some of the technical features of our webinar today. We do have a couple of ways that you can reach us as panelists here, hosts and panelists. If you have technical questions or anything like that, there is a chat box that you can use. The chat, if you click on everyone will see your chat, or you can click on panelists and it will only come to those of us here on the screen. If you have a technical difficulty, please use that chat and we'll help you figure it out. If you have a question during the webinar that you would like to ask of Corinne, maybe at the end, as we have time, you may submit that in the Q&A box. That will just come to me and I will write that down for later in the presentation. We appreciate those of you who submitted questions as you registered. We have 5 or 6 of those. So we'll be getting to those, prior to any submitted here live, but we like to get your questions and maybe we can always email them to Corinne later if you do have questions that come up. While we're together, for those of you who are in WifeSavers and attend our other live events, we sometimes use the chat box during our events to encourage each other and share our thoughts and feelings. We'd ask you to hold off on that today as much as possible during Corinne's presentation so we can all be focused in on her and show her that respect. But definitely don't hesitate to reach out if you have a technical issue. And again, the Q&A box if you have a question for our presenter. And for those of you who stay with us through the entire presentation, Corinne has a free gift that she'll be giving away to those of you who are left at the end. And Ramona also has a couple books that she's going to give away. So it'll be worth it, not only for the excellent information, but the chance to win something to stay with us today. We are recording this session and it will be available in the replay section of the WifeSavers membership page. Probably within a week or two. And so that will be available to our WifeSavers members. And again, if you're interested in what is this WifeSavers thing I keep hearing about, if you're new to us, go to wifesavers.org. And with that, I'll turn it over to you, Ramona, and you, Corinne, and we're excited to hear from you.
Woohoo! Thank you, Emily. I can't live without Emily. She is like half of my brain, at least. So, and as you can see, she's delightful to be with. And you are all delightful to be with. We're so thrilled to be together in this WifeSavers special guest live webinar. We do the special guest live webinar 4 times a year. So only 4 people out of the whole universe gets to come and talk to us every year. And I really am selective, and I always want these really special times together to be deeply enriching and empowering. We don't ever sell anything or anything like that. You won't get any sales emails or anything like that after these webinars. This is purely our gift to you because we love women and we want to do everything we can to make your life powerful and what's the right word? Powerful and just blossoming. We want you to thrive. Of course we do. And that's what the WifeSavers course and community and the WifeSavers podcast and everything that I and my team do is for your heart. And guess what? Your health. And that's what we're here today, especially to talk about, is your health. And one of those very special people that we have on board today is Dr. Corinne Beaumont Ellsworth. And I'm thrilled that I was introduced to her, I don't know, a few months ago, right, Corinne? It was a few months ago by a mutual friend. Mm-hmm. And I knew after just a few minutes of conversation with her that you all just had to meet her and to hear her message. So Emily's told you all about her, but I'm sure she can tell you a lot more. And of course, as Emily said, save your questions because she's very generously going to spend a little extra time with us at the end of her presentation to answer your questions. All right. So Corinne, I have to tell you that I have a history of breast cancer in my family. My mother had several sisters, and 5 of the 6, had breast cancer. Wow. And in later in life, but I think I'm later in life right now. So knowing that many, we know so much more now about early detection, breast cancer, and so forth than 30 years ago when I started having mammograms. But my doctor and I agreed that we should be really vigilant. So every year since I've been 30, I've been going in for a mammogram, and I do my self-check very religiously and so forth. I thought I knew all about it. But then I went and looked at the Know Your Lemons app. I love that app, Corinne.
So glad.
It is so brilliantly designed. And I know that's your forte. But I loved everything about it. The information was so helpful, and a lot of which I didn't know, right? But the way it's presented is so fun and so pretty, frankly, and so clever and so easy. It's just so accessible. I really recommend it to, I know Corinne will tell you more about it. You guys, you have to download the Know Your Lemons app. It's totally free. This is really a charity organization that Corinne runs. So it's a gift. and you should really take advantage of it and share it with all the women you love. I mean, this is life-saving information, nothing less than that. So with that, and I'll give you lots more insight and recommendations as we go along, I am going to turn the time over to our very special guest, Corinne. Take it away.
Thank you so much, Ramona. That was a lovely introduction for you and for Emily. Thank you. I'm so happy to be here and really just to talk to you today about breast health. Breast health is something that we don't talk about in schools, and we don't really talk about it in our families either. And we're going to change that today. And maybe you'll mark this moment as the moment that didn't know what you realized you didn't know about breast health. And then after today's webinar is over, you're going to be full of information and it's not going to be overwhelming. I hope it will be really kind of inspirational, and it will help you have a desire to tell other people about how they can better take care of themselves, because being able to take care of our breast health should not be a secret. And right now it is. So that's really my job, is to make this information not a secret and share it with everyone in a way that's really accessible. So
yes, and that's exactly what you've done. Not only have you made it accessible, you made it appealing.
Thanks.
It's actually fun information to learn, not dread it or I have to. It's fun. So Thank you for that.
Thank you. And also for everyone who stays till the end, there will be a student feedback form, and everyone that fills that out gets a $5 voucher for the Know Your Lemons charity shop. So everyone will be getting a gift, but there'll be one person that will be getting a free mug. So I hope you can all stay.
All That's fun. And the shop is full of fun stuff, everybody. It's full of fun stuff.
All right. So this is my foundation. It's called the Know Your Lemons Foundation. And this is the reason why. It's really fun when people ask me, what is it that you do for a living? It's really hard for me to explain. I use lemons to educate people about breasts. But when I can show the picture, it becomes really clear the value in how we educate. So I'm going to start something a little bit differently. I'd love for everybody, like if you have a phone, or you could do this separately on the computer. So I'll be giving an introduction, kind of telling you my story of how the foundation came into being and my work. And while I'm doing this, I'd love for you to be taking our breast quiz on the website. So if you go to knowyourlemons.com/learn, when you pull up that page on the website, right at the top is going to be a button that says take our breast quiz. So if you can click on that, and then you can kind of go through this quiz as I'm kind of talking in the background. And you can look up at the screen and see what I'm doing. But if you can, this is a great way to kind of help you understand maybe the knowledge you have and maybe the knowledge you don't have right now. So if you go to knowyourlemons.com/learn and then click on take our breast quiz, it takes about 5 to 7 minutes to fill out the quiz, depending on how thoughtful you're being about things. But that would be great. All right. So knowyourlemons.com/learn and then take our breast quiz. So maybe Emily can put that in the chat for everyone in case. All right. So this is me and my daughter and my dog Daisy. We currently live in Salt Lake City. And I am so happy to be here. I'm originally from Idaho, and I grew up on a potato farm. So I would spend my Octobers having a couple weeks off of school to work in spud harvest. So this is a picture of my dad, and he is a farmer, and he also invented some dairy machines. And my mom is a musician. She plays piano. So I grew up in a really kind of creative, inventive, entrepreneurial family in Idaho. And then I moved to the UK to get my PhD, and I lived there for 12 years and became a dual citizen. So I am British and American. And this is me during my swearing in ceremony. If you have any questions about what it's like to become a UK citizen, I'm happy to answer that too. But it was a really neat experience. So my daughter and I love to travel. She's been on 88 flights. She's 8 years old now. And we love to sketch. So we have our sketchbooks that we bring with us when we go on our trips. And we always take time to sit and draw what we're looking at. So this is a picture of Olive drawing her version of the mountains. And I love how colorful it is, and how she's, learning to see the world around her is what I love to do with us together. So let me tell you a little bit of why Know Your Lemons began. So this is me back when I was getting my master's degree at Utah State University, and I was doing my Masters of Fine Art exhibition. And you can see in the corner there's a bouquet with lemons in it. So the lemons thing has been around for quite a while. This was done in 2003. So this is me with my parents. The photo next to my mom is my maternal grandmother. And she was diagnosed with breast cancer in her late 50s. And she actually passed away while I was starting my master's degree, which was really pivotal in my work. I'll explain that a little bit more. And then the photograph next to my father is his mother. And she passed away from breast cancer at age 39 when my dad was 12 years old. So I never knew my grandma Beth, but I did know my grandma Sandra. And when my grandmother passed away and I was just starting my master's degree, I thought, now I have two grandmothers who have died from breast cancer. And I'm wondering what it is that I need to know for myself about this disease. Is there, should I be getting mammograms now in my early 20s? I was really, wanting some answers and trying to understand this. And it wasn't that my family had this conversation. It was me, wanting to know this information for myself. So I ended up going to a cancer library where I said, this seems to be something that's in my family. What should I be doing? When should I start getting mammograms? What does a lump feel like? Am I actually at a higher risk for breast cancer? And they weren't sure what to do with someone who was in their early 20s asking these questions. So they gave me lots of leaflets. They directed me to some websites. And I remember leaving the cancer library with more questions than I had than going in. And I just realized from a design point of view, this wasn't a good information learning experience. It was confusing, and I still didn't have an answer to my questions after I left, after looking at all these materials. So I ended up doing this work for my master's degree, decided to take on this project of how can we make the message about breast health easier to understand. So I came up with this Know Your Lemons campaign, which I'll show you in a little bit. But I got my master's degree with that. And then I was working as a creative director at the university for a couple of years, and just felt like this Know Your Lemons project had more potential in it than had been achieved. So I applied to get for a PhD program in the UK, and then I was given a scholarship to go. So I quit my job as a creative director, and I moved to the UK to work on this as part of my PhD. So after a few years, I finished my PhD in design thinking. And at the time I was married, and then had my daughter. And during the time I was the design and business professor in London at the university for 7 years. Then life took an unexpected turn, and my marriage fell apart. And I had some decisions to make. And it was, I could keep my job as a professor and have this reliable income, or I could kind of take another leap and quit my job, quit my steady source of income, and focus on this project full time. At the same time, my really close friend that I had grown up with, mother of four, she had metastatic breast cancer, which means it had left the breast and gone to other organs. And after a 7-year battle, she died with breast cancer. So, and it really, really impacted me. So I decided to take the leap again, and I quit my job and I started the charity. And I'm so glad that I did, because it has helped so many people and has been such a fulfilling part of my life. So a lot of days with the charity looked like this. My daughter, I called her my undersecretary. She would play underneath my desk as I would work. And she'd bring her Barbies in and things like that. And the house was messy, but we survived. So this is the glamorous life of what it looks like to start a charity using your own savings. And then something really big happened. A patient shared online that we should be sharing useful information when it comes to breast cancer awareness. Let's stop sharing pink ribbons. Let's stop sharing hearts. Let's actually share information that helps people. So she shared the image, these 12 signs of breast cancer, which I'll show you a little bit more in a minute, online, and it absolutely exploded. Everyone started sharing it. They said, this is so interesting. I've never seen anything like this before. I was interviewed by the BBC, and they put it on their website, and it became the 5th most popular story that day, which was pretty interesting. And then this is a German TV station that came to my house to interview me about the work as well. And while this was going on, my daughter was upstairs in her room whining because she couldn't get her bag of Skittles open. So we had to stop filming for a bit. So, it's not all glamorous. These kind of behind the scenes stories are fun. And then I was invited to be on BBC Breakfast to talk about the work. So let me see if I can kind of move this around. So the work really started going in 2017 when everything became viral. I had 7,000 euros, so about about $8,000 to $10,000 in savings that I used to start the charity. And today I have, we're now 3 full-time employees and 1 part-time employee. We have a big advisory committee. We've reached 1 billion people online. I wish we had 1 billion followers. That would change everything. But we have 1 billion people who have seen our work, who have shared our things, who have read stories about us. We're also now in 28 languages. So this slide is only 3 months old. So already we're updating quite a lot of information. We're in 99 countries. We got an award for our Know Your Lemons app. And we have 210 volunteer educators, which is really amazing. And now we are an associated member of the United Nations Department of Global Communications. And what that means is we are aligned with them to help with the goal to reduce cancer burden. And for us specifically, it's to educate about breast health so that women can get diagnosed earlier so that they can survive. So this is a photo of me speaking at the United Nations conference in 2019, which was really exciting. All right, so now I have a couple questions for you that we can all do together. And if you want to just say what your answer is into the chat window, that would be great. So we have 2 questions.
Is this the poll you wanted to launch?
Yes.
I got it ready to roll if you want.
Oh, great. Excellent. Okay, so we've got a poll, so you don't have to do it in the chat window. Fantastic. Okay, so how often around the world is a woman told you have breast cancer? So do you think it's every 15 seconds, every minute, every 5 minutes, or every 15 minutes? And then question number 2 is how many people diagnosed with breast cancer have a family history of the disease? So this is percentages. So do you think it's 15% of people diagnosed with breast cancer have a family history? Is it 40? Is it 65? Is it 85? What percentage of people that are diagnosed with breast cancer have a family history of the disease? So we'll give everyone a second to kind of fill in that answer. And then we'll see the results.
You might have to scroll down or up a little bit, guys, to see all the answers. Well, we got a lot of people answering. This is going to be interesting.
All right. Let's see the results.
Do I share the results? Is that how?
Yeah, that would be great. Okay, so the most popular answer, half of you think that a woman is told that she has breast cancer once a minute. Someone is diagnosed around the world. And then how many people diagnosed with breast cancer have a family history of it? Most of you think it's 15%. So that means 85% of people have no family history of breast cancer. All right, well, let's find out if you're right. So the answer is every 15 seconds. Around the world, someone is told they have breast cancer. And every 5 minutes, 6 women die from breast cancer.
Wow.
And as of this year, breast cancer is the most common cancer in the world.
No kidding.
Which is pretty amazing considering only 1% of cases of breast cancer are men. So
what? Wait, Corinne, what did you say? What percent?
1% of breast cancer cases are men. So 99% of people diagnosed with breast cancer are women. So if you think about breast cancer being the most common cancer in the world, and it really only affects women statistically, how big of a burden is that on women? The basically female-dominated cancer. The number 2 cancer is lung cancer, and that affects men and women fairly equally. But breast cancer is the most common cancer in the world. So we have a lot of work to do as a charity, for sure.
Wow.
All right, so how many people diagnosed with breast cancer have a family history of the disease? You guys were right, it's just 15%. So not having breast cancer in your family actually doesn't lower your risk. And we'll be talking a little bit more about risk next. All right, so my other question to you is, have you ever done a self-exam? That was something that was asked of you in the breast health quiz. So, we're not able to interact in the webinar format, but just kind of think about that. Most women don't do self-exams. Very few do them monthly. And of the ones that do them, a lot of them say that they're not that confident and that they're doing them right. And this is because we're not really taught how to self-exam. We're told to feel for a lump. We're not told what a lump feels like. We're not told what breast anatomy is like to know that lumps are normal, because there are things inside of our breasts. So we'll be talking about some breast anatomy today, so you can kind of understand what it is that you're feeling when you do a breast exam, and then what it is you should be looking for that's different. So there's a survey that we did with Avon where we surveyed 14,000 women around the world. And we asked them about the different signs of breast cancer. And so what percentage of people do you think might know all the signs of breast cancer? So maybe just think about that for a second. And the answer is 2%.
Oh,
2% of women know all the signs of breast cancer. But we have been talking about breast cancer awareness for decades. We dress up in pink, we run races, we have pink socks, pink hats, pink stickers, pink necklaces, pink ribbon earrings, right? Like I'm wearing today. And we talk about breast cancer awareness, but we are not educated. So we know breast cancer exists. We are aware of the disease, but we are not educated on what we need to do for most of us to actually find it as early as possible. So that's going to change for everyone here today. So that's my goal. I want to educate you and make sure that you feel confident and that you understand what you can be doing to understand this disease, this cancer that impacts so many people. So this is why early detection is so important. When it's diagnosed in stage 0 to 1, it's pretty much 100% survivable. And survival rates are measured in terms of 5 years. So if the patient is still alive 5 years later, then that's considered survived. But when it's stage 4, 1 in 5 people nearly are still alive 5 years later. So this is why early detection is just so important, is that in stage 4, when it leaves the breast, it goes to other organs. We can live without a breast, but we can't live without a brain, lungs, liver, or bones. And that's where breast cancer spreads to after it leaves the breast. So that's why it's so important that we help women find breast cancer in as early of the stage as possible. And the earlier stage, chances are you won't need to have chemotherapy. So it's less of an impact on your life as well. So there are 9 factors that increase your risk for breast cancer. And I'll talk about each of these icons. So the number 1 risk for breast cancer is getting older. So the older you are, the more your risk increases for breast cancer. And the statistic of 1 in 8 women getting breast cancer in their lifetime is based on someone making it to the age of 70 or above. And then the younger you are, the less your risk is for breast cancer. On our Know Your Limits app, you can, if you have the iPhone version, we don't have this yet on Android, we're working on that this year. But you can actually use a scale, and you can slide your age up and down to see how your risk changes with your age, which is really interesting. The other thing that increases your risk for breast cancer is exposure to estrogen. So the more periods you've had in your lifetime, the more exposure you've had to estrogen, which is responsible for helping breast cancer grow in a lot of cases. So by more periods, that can mean maybe you started your period when you were before age 11, or you didn't enter menopause till a much later age than most people. Breastfeeding can reduce your risk for breast cancer because while you're breastfeeding, you tend not to have periods, that sort of thing. And then medications that contain estrogen. So that's something to talk to your doctor about, to say if there's a medication that you have, if there is a link to increased risk for breast cancer. So just understanding the benefits of the medication versus the potential risks is always important to do. Another factor is being overweight. And this is because fat stores and produces estrogen.
Wow.
And so being overweight, especially after menopause, really increases your risk for breast cancer and other diseases. Which is fascinating. I just find it fascinating that fat can store and produce estrogen. But
that is the first time I have ever heard that.
Yes.
That is really interesting and very motivating, isn't it, ladies?
Yes.
Just another reason.
Another reason. It's not just breast cancer. It's a whole host of things, right? And then lifestyle habits. So alcohol can increase your risk for breast cancer. Smoking can increase your risk for breast cancer. Not eating healthily, which leads to being overweight, right? So those things contribute to each other. And then lack of physical activity. So this is, a person just sitting down and not doing anything. That can also increase your risk for cancer and other diseases. And then these last three green icons are talking about breast types. So dense breasts, having really dense breasts can make it, can increase your risk for breast cancer. So half of women in the US have dense breasts. It's pretty common. We'll be talking about breast density a little bit later. And there are some breast conditions that can increase your risk if you have atypical hyperplasia. You will only know that if a doctor's said that to you. So don't worry if you go, I wonder if I have atypical that's something that would be found on a mammogram or an ultrasound. And there's also something that's very common, which is fibrocystic breast disease. That doesn't increase your risk for breast cancer. It's just annoying because it makes your breast tender. They tend to be a little more lumpy, which is not harmful. It's just annoying. And then lastly, genetic factors. So if you have a sister or a parent who has had breast cancer, that doubles your risk for breast cancer. So those are some things to think about when it comes to risk. And then you can learn what your personal risk is for breast cancer on our Know Your Lemons app. Again, this is just the iPhone version, but on the Android version, it goes through each one of these risks as well in detail, and you can read about them. But the risk assessment quiz helps you figure out what screening plan you should be on. So according to your risk factors, which is really helpful.
And Corinne, I did that and loved it.
Oh, great. I'm so glad. So now I want to show you this 3-minute video that gives you an overview of kind of all the early detection basics. It's hosted by Mona Lisa. So I hope everybody can hear it. And we'll start the video. Okay.
Hi, I'm the mayor of Lemonland, and I'm here to help you know your lemons with my friend, Mona Lisa.
I've been checking my lemons for 500 years and have a lot to tell you. A cancerous lump is a lot like a lemon seed because it often feels hard and immovable. It can be any shape or size. This is the lump you investigate. There are 2 innocent lumps to know. One lump feels like a soft pea. These are your milk lobes, normal. Another lump feels like a soft bean. These are your lymph nodes, also normal. But you need to know how to feel around for these good and not so good lumps. Mayor, do your thing.
Thanks, Mona. Use your 3 middle fingers in circular or up and down motions. Use 3 levels of pressure, light, medium, then deep enough to fill your ribs. Also, fill under the nipple. You need to cover an area that includes your lymph nodes. So start in your armpit, then to your collarbone, and finally work your way down to the bottom of your ribs. Use 2 positions. 1, lay down with your arm behind your head. This flattens everything. 2, bend forward. This brings everything to the front. Finally, look for changes in front of a mirror. Move your arms up and down and turn to the side. See if the whole breast skin moves with you as you move your arms.
Look for these changes.
Because a lump is not the only sign.
Grazie, Mayor. The best time to feel around is 3 days after the end of your period, when everything is most normal. No period? Pick any day you like, consistently each month. Your risk increases with age, so stick with it. I've been checking my lemons, but it's not enough. I also get regular mammograms because a mammogram can find a cancerous lump before it can be felt. Just look at my hand to learn the difference. This is the average size of a lump found by accident. a lump through self-exam, a lump found with one mammogram. But with several mammograms to compare changes, the lump can be the smallest. If cancer is present in the breast 8 times out of 10, a mammogram can find it. But if the results come back normal and you're still concerned about something, or if you're too young for a mammogram, ask about an ultrasound if you have a specific lump in mind, or get a new view with an MRI. But the only way to determine if it's cancer is to actually look at the cells, which is through a biopsy. Most lumps turn out to be fine, so don't panic if you need to check it out to be sure. Trust your instincts and know your options. When breast cancer is found early, survival rates are very high. Knowing that I've educated you makes me smile.
Share this app with a friend today at knowyourlemons.com.
Thanks, Ramona. So there you go. So we'll talk about some things that were covered in that video, but that gives you a really quick overview of the basic information that you should know. So the first one is talking about self-exam. And what's great about this is no one's sharing their video, so you can actually do this along at home and kind of practice a little bit. So this shows you what breast anatomy looks like, right? So interestingly enough, when you cut a lemon navel to navel, it looks a lot like breast anatomy. So we have milk ducts, which is that white kind of vein part that goes to the nipple. And then we have milk lobes, which kind of feel like soft cooked peas. And then milk lobes, which feel like soft beans. So the area that you should be feeling yourself in a self-exam is your armpits up to your collarbone and down to the bottom of your rib cage. This is because you have breast tissue that goes into your armpits. And then if breast cancer has a very kind of predictable way in most cases of spreading. And so it will go to the lymph nodes first before it leaves the breast. And you have lymph nodes that are contained by your collarbones and in your armpits as well. So that's, and then kind of in the middle. So I'll show you the diagram of that in a minute. But this is why you need to fill this full area when you're doing a breast exam. It's not just about the part the bra holds. It's into the armpit, up to the collarbone, to the bottom of the rib cage. So this is where lymph nodes are located. So you can see it's there by the collarbone and in the armpits and kind of around the outsides of the breast. There are also some lymph nodes that kind of go down through the sternum as well. So there are 3 positions to use when you're doing a self-exam. So I'd love everyone to kind of try this out at home, just in terms of kind of feeling the difference. So the first one is if you put your hand behind your head like this, what you'll notice is that you'll feel kind of everything kind of tighten and lay more flat. So when you're laying on your back and you're doing that, or you're standing up and you're doing that, like just notice the difference between having your arm down and then having like your elbow up. You can really tell that like it's pulling kind of everything kind of more flat. And then if you stand up, so I'll stand up with you. Ramona, if you want to try this as well.
I have and I will. Okay.
So you stand up and then you kind of lean forward, kind of like a candy cane shape. And then if you could just like feel like one of your breasts, what you'll realize is that like everything kind of comes forward, which is the opposite of what pulling your arm behind your head does, right? And what you might do is kind of like loosen and relax so you're not like flexing any muscles there or anything like that. Just like make it nice and loose. So that, and then you feel the same area. You go ahead and stand up now. And you can feel the same area with that, which is helpful. So it changes the landscape of your breasts, because sometimes you won't feel something because everything's pulled tight, but maybe you'll feel something when everything's hanging forward. And then the last one is to do it in front of a mirror, where you look for visual symptoms of breast cancer to see if maybe one breast has gotten larger than the other. It's really common for breasts not to be the same size. We all know that.
but it's changes. So it didn't used to be this way is something that you need to know. So the only way that you'll be able to say it didn't used to be like this is if you've actually done it regularly and you know what your normal is like. And that is the whole point of self-exam, is to know what's normal for you. It's not a hunt to find cancer. It's to know what's normal for you. And that way, if something changes, you go, hey, that's not normal for me. So when you're in front of a mirror, what I find really helpful is if you have like lighting that's kind of above your head, and it doesn't have to be that way, but it kind of shows up shadows a little bit better if you have overhead lighting. Again, not important, but that's just something I've discovered. But like if you put your hands above your head, and then what you do is you lower them, there's a symptom of breast cancer that will, the tumor is pulling the skin in towards itself, and that'll be easier to spot when you raise your arms up.
Oh, interesting. This is all so interesting. No one teaches you this.
No, and it's easy. It's really simple. And when you lower your arms, if the whole breast doesn't kind of all move together, that's when you can kind of spot that symptom, that dimple, a little more easily. So you put your hands on your hips. Again, that's to kind of like put your breasts in a different position than up here or down, right? So that's the third position to look for. And when you should do a self-exam should match according to your breast cycle. So our breasts have cycles, and it's in sync with your menstrual cycle. So if you no longer menstruate, then do it the first of every month as a good reminder. Say, oh, it's March 1st. It's time for me to do my self-exam. And it doesn't have to take long. Again, it's for you going, is everything still normal? Yeah. Okay, great. But if you are menstruating, the best time for you to do a self-exam is right after your period finishes. So here on the Know Your Lemons app, it's showing you there's kind of this window of green, and that's kind of your go time to do a self-exam. And the reason for that being is that's when your breasts are the most normal, because toward the end of your cycle, where it's kind of those black dots, this is where progesterone comes in, and it can make your breasts swell. They can become really tender. They can become lumpy because your body is preparing for a potential pregnancy. So that changes your breast, because it says to your breast, hey, there could be a pregnancy, coming up. So let's work things. And then you have the periods like, we're not pregnant, right? And then it kind of dies down for a bit. And then, so that's when you should be doing your self-exam. So you can use the app as a period tracker. And then it will tell you, this is the time, like kind of these next 5 days for you to be doing your self-exam. Which is really helpful. And then if you're not menstruating, then this just turns into a dial that counts down every month for you and sends you a notification of, hey, it's time for you to know your lemons, which is really great.
So Corinne, that window is that it's like any time in that window is the optimal time. Not that you have to do it every day in that window.
So just do it once sometime in that window. And everyone's going to be a little bit different, right? Everyone's bodies are different. So it might be, it's going to be better, like more towards the start of that window. For some people, it might be better more towards the end of that window. What you don't want to be doing is a self-exam when your breasts are swollen and tender and lumpy, because then you'll be going, oh, there's all kinds of things happening here. All right. So, but the best time for you to get a mammogram is also that window. To get an ultrasound is that window, because you'll be comparing like for like. You won't be comparing your lumpy breasts to your less lumpy breasts from month to month. You want to be comparing the same breast every month, because our breasts change. Isn't that fascinating?
It is. It is. I had no idea. Seriously.
Tell all your friends, did you know that our breasts have cycles?
Yes. When the conversation lulls a little bit, just throw that in there.
Next dead space, you know what to say.
So, and then we have an audio guide where Mona Lisa talks you through step by step, explains how different parts of the breast feel. And that can also give you a little more information. Like, for example, this upper outer corner is going to be more lumpy because more stuff is there in our breasts. So that's really interesting. Okay, so how many symptoms of breast cancer are there? You should know by now, but the answer to that is that there are 12. So I'll talk about these a little bit one by one. In the Know Your Lemons app, we describe each symptom in detail. So what you can do is look up the symptom and read more about it, and that can give you more information, because not every breast change is cancer, right? But it's good for you to notice any changes and then keep an eye on it. So it's really typical for a lump to kind of come and go with a menstrual cycle. But if you're noticing something is getting worse or something stays persistent, regardless of where you are in your cycle, if you're still menstruating, then that's an indication of this is a change that's not really going away. And it's smart for you to tell a doctor about it. So 80% of lumps that are investigated turn out to not be cancer. So if you find a lump, don't immediately go into panic mode thinking, I've got breast cancer, right? So say, I've got a breast change and I'm going to be smart about this. And I'm going to bring this to the attention of my doctor and get it checked out. And that's all you should try to let yourself think at that point, right? But so there are a couple of different things. So we'll start with thick mass. So a thick mass means there's like a thickened part of your breast that just doesn't feel like the rest of the breast. So it's kind of like a lump, but it's a little bit less defined, but you can definitely tell like there's like a hardening somewhere. A dimple is the one I talked about. And again, that's where a tumor deep in the breast is pulling the skin in towards itself. A dimple can also be like cellulite. So that's, we have dimples all over our body, right? There's no reason why you wouldn't have a dimple on your breast as well. Sometimes you can fill a lump with the dimple, sometimes you can't. But if you notice an indentation like that, it should be checked out. Nipple crust, this is something called Paget's disease, which is where cancer is in the nipple, and it can turn scaly, it can go red. That would be something to get checked out. That's also really common with breastfeeding, right? So if you're breastfeeding, there's lots of breast changes too. Again, like trust your instincts. If something just doesn't seem right, like trust that instinct. That is when we hear stories from women talking to us about getting diagnosed, it's their instinct that helped them kind of advocate for themselves until they got the answer that they needed. So trust your instincts. The next one is if the skin turns red, maybe it might look like a bruise, or it feels hot, or it feels like warm in an unexpected way. This is a sign of inflammatory breast cancer. And this is where it's impacting towards the surface of the breast and is changing what the skin looks like or how it feels. This is something that won't get picked up on a mammogram because there's no lump for this one. So that's just something to watch out for. Again, if you're breastfeeding, mastitis is really common, right? If you got hit in the breast and you have a bruise, then that has an obvious reason for it. Getting hit in the breast will not cause breast cancer. And along those lines, underwire bras do not cause breast cancer. Basically, anything that anyone's told you causes breast cancer probably does not cause breast cancer. So, deodorant's fine. All of those things, like if it wasn't on the risk factors I've shown you, then you are okay. Fluid leaking from the nipple, unexpectedly, if it's clear, that can be a concern. If it's milk, what that fluid is. Maybe you might have a bloody discharge. That's also something to look into as well. Skin sores. This is a really advanced sign of breast cancer. We usually see this in developing countries where cancer is kind of eaten through to the surface of the breast. A bump, that's just a lump that's on the surface of the breast. Growing veins, this is less common of a symptom. Again, with breastfeeding, you're going to have growing veins, and that's just part of what needs to happen for you to breastfeed. But sometimes what can happen is cancer needs a lot of blood to feed itself. And when it demands more blood, the veins might grow in response to supplying blood supply to the tumor. So growing veins can be a symptom of breast cancer. Sunken or inverted nipple, inverted nipples are common, but if you didn't have one and now you do, then that could be a sign of a tumor underneath the nipple pulling it in towards itself. So that should be looked at. A new size or shape of the breast. Maybe your breast used to be up here and then one of them is suddenly drooped or one of them suddenly gotten bigger. Then that can be an indication that something's happening inside the breast. And then orange peel skin. Sometimes there is a discoloration that happens with it. Sometimes it doesn't, but there's lots of little dimpling and it looks like the skin of an orange, almost like a peel. So that would be something to look out for as well. And then the most common symptom of breast cancer is a hard lump that's often immovable, like a lemon seed. So if you're doing a self-exam and you're feeling lumps that are squishy and you can move them around, that is most likely going to be just the normal anatomy of your breast. But if you feel something that's hard, doesn't really want to move around, then that's something that needs to be checked out. It could be a cyst, it could be a tumor, but it needs to be checked out when you find something like that. So when you are educated and you participate in screening, your chances of dying from breast cancer reduced by 60%, which is pretty big. So I could give you all this education, but only you can make sure you get screened. And right now we're seeing fewer women getting screened for breast cancer because of the pandemic, but also people just feeling like it's not that important. But actually it's incredibly important to get screened when you don't have any symptoms. And when you do have symptoms, to be able to report them to a doctor. I'm getting calls from clinics saying people are not reporting symptoms like they used to be. Mm-hmm. We're concerned because we know about this many people every year find a symptom and get diagnosed, and fewer people are reporting symptoms, and it doesn't mean that cancer is not there. So make sure that you get screened. So together, if you could hold up your hand like this, we'll do a little learning exercise. So if you put your 3 middle fingers together, that's about the average size of a lump found by accident. So meaning if you are not doing any self-exams, you're not getting screened, then the chances of you finding a lump are going to be about this big.
Wow.
Yeah. If you do regular self-exams, then the average size of a lump found is the size of your thumb. That's a huge difference. Just doing self-exam is a really big difference. If you get 1 mammogram, so cancer was found like on your very first mammogram, the average size of a lump is the size of the tip of your finger, which is great. And if you have multiple mammograms to compare, so they say, okay, last year it looked like this, and this year we can see a difference between these two, then the average size lump found through a mammogram is the size of a pinky, tip of your pinky. So this is why mammograms are so important, and this is why self-exam is so important. And breast cancer can show up between mammograms, so that's what self-exam is for. It's for in between mammograms. It's not to replace mammograms. It's to help you along. Do you have to do it every single month? No. Just do it often enough that you're going to be able to spot a change if something happens. So don't feel guilty if you miss 1 month.
Are you going to tell us the frequency of mammograms optimally?
Yes. So that will that will differ based on what your risk is for breast cancer. So I really encourage you to go to the Know Your Lemons app to find out what your specific recommendations are. But starting at age 40, you should be getting a mammogram about every year. And then if you have a history of breast cancer in your family, then you need to talk to your doctor about that and see if maybe you need to start mammograms earlier. Maybe they'll say, let's add an MRI to this, that sort of thing. So it just depends. Because of my family history of breast cancer, I go in a little bit more often than others do. But if you have an average risk of breast cancer, then the easy thing to remember is age 40, start getting a mammogram every year. So there are a couple reasons for these mammograms, and this kind of shows you like the steps that you would take to investigate a symptom all the way to cancer or finding it's not cancerous. So at any age, you should be doing a self-check. Once you have breasts, you should be doing self-exams. And if you're like advising a teenager, maybe you've got a daughter or somebody that you're talking to about this, let them know that there's lots of changes that happen as breasts develop. And that's really normal. But it's about being in the habit of like, are you aware of what's normal for you? And that it's okay to touch your breasts, that it's okay to check yourself. So if you notice a symptom, then the next step you would do is to tell your doctor. And then the doctor should refer you to get a mammogram. And if you have no symptoms, then you can just start with the screening mammogram. You don't need to go to your doctor first. Some imaging centers ask for a doctor referral before getting a mammogram for screening, and some don't. So that just kind of depends on your imaging center that you're going to. The Know Your Lemons app tells you what all the imaging centers are near you, and you can book an appointment through the app as well, which is really handy. So I just want to tell you a story really quickly about a patient that came to us. She noticed a symptom of breast cancer, and she went in to talk to her doctor and said, "Hey, I've noticed that something's different." And she says, "Well, you're young. We're not, that concerned. It's probably nothing." So she was sent home. And then she saw the 12 signs of breast cancer and said, "Actually, I have 2 symptoms." So she went back to the doctor. She actually showed her the 12 symptoms of breast cancer and said, "I want a mammogram." And then the doctor said, "Okay, all right, we'll let you have a mammogram." And then she got the mammogram, and then they sent her on for ultrasound because they noticed something on the mammogram, right? Like if you have a symptom, then sometimes a mammogram can kind of give you a lot of information about it. Sometimes it can't. So sometimes an ultrasound will be needed to follow up, because an ultrasound can kind of look at something in more detail if you have a specific area. So it's kind of like looking for a needle in a haystack a little bit, because ultrasound magnifies things quite a bit. It's kind of like if you have binoculars and they say, "Look at that thing over there." Like you're going to need to know that really specific spot to look in, or you could be looking for a long time with those binoculars. So that's kind of what ultrasound's like. If you have something that you kind of feel or see, then an ultrasound is a great way to kind of look at it in more detail. A mammogram is like taking a picture of the whole area of the breast and saying, are there any areas of concern? Yes, we have an area of concern. Okay, let's get the ultrasound out and look at this area of concern in more detail. And when she got the ultrasound, they were able to tell that there was cancer that was probably there. So then she got the biopsy, where they look at the cells under a microscope to see if it is cancer. And then she was diagnosed. And we hear this story again and again of women going in, talking to their doctor, saying, "I think there's something wrong here." And sometimes the doctor is a little bit, there, we don't want to upset you. It's probably nothing. Just go home, right? But if you say, "And I would like a mammogram," then that's much harder to turn down. To say, "I have a concern, I want this investigated, and I would like to get a mammogram," can really make the difference. And it's a lot of women who are able to advocate for themselves, particularly those who are under age 50, because they tend to get a little bit more dismissed. Then that's important. So knowing that these are your options for testing can really help you understand the big picture and realize when the doctor's not referring you when they should be. So that's really useful information. So here's what different tests look like. This is a mammogram. All of these breasts are healthy. So there's no cancer in these pictures. And this shows you the difference between different breast density. So if you do not have dense breasts, that's this image on the far left, you could see it's real easy to see what's inside the breast there. That's because most of the tissue is fatty. Once you're turning 40 and above, your breast tissue becomes more fatty, which makes it easier for a mammogram to see things. So cancer on a mammogram shows up as a white mass. So if you have extremely dense breasts over here, like 75% of your breast is extremely dense, you are not going to be able to see cancer on a mammogram. So when you get a mammogram, they will send you back a report letting you know if you have dense breasts or not, but they very rarely tell you what level of breast density you have. So it can be useful to ask the doctor, can you tell me what level of breast density I have? Like, do I have extremely dense breasts? Because if you have extremely dense breasts, then a mammogram is not going to be that useful to you. And so like an ultrasound or a breast MRI might be more useful. There are ways of kind of doing like a screening ultrasound that can be effective for you.
Is there a 3D versus 2D or something along those lines that help? What is that about?
Yes. A 3D mammogram, which basically they take a couple different pictures from different angles, and then the software kind of puts those different pictures together in almost a 3D view. It's still a 2D picture, but it kind of shows up anomalies a little bit better. That can be more useful with dense breasts. But it's good to understand like what, breast density looks like and to ask about your breast density. So we're trying to work with imaging centers to help them more easily report this information back to women so that they can understand and advocate for themselves. Because if I had extremely dense breasts, then I would know, oh, okay, if I get this mammogram, it's only going to maybe catch 2 out of 10 cancers if it's present in the breast. So maybe I need a better screening option. And then you would talk to your doctor about that. So that's just something to know. Extremely dense breasts are not that common. So that's something to take into consideration. But half of women have dense breasts. So that's going to be anything 25% above or more. So, and this is what an ultrasound looks like when it's looking at a lump. So the one on the left is a water-filled cyst. And you can tell because it's kind of more circular oval shape. And sometimes there will be things inside and sometimes there won't be. If there are things inside, then it's usually called a fibroadenoma, which again is harmless. And then the one on the right has an irregular shape. And this indicates something could be a problem. So sometimes they can do an ultrasound and they go, oh, this lump that we found on the mammogram is a cyst. And then that's as far as you need to go. But then if they go, something still looks interesting here, let's do a biopsy and find out what's happening. So 80% of biopsies done turn out that it's not cancer. So that's another thing to kind of be aware of, that if you have to get a biopsy, 80% of the time it's okay. So, and this is what a breast MRI looks like. So here you can see that there's a large tumor on the right side, and you can see the veins have increased with blood flow. You can see that the breasts are different sizes, different shapes. So that gives you an idea. So MRI is really detailed. It's a bigger test. They're expensive, that sort of thing. But that's what a breast MRI looks like. So as I said, breast cancer is now the most common cancer in the world. And we're doing a lot to change this global problem. So we recently did a study in the Netherlands with 1,400 breast cancer patients. And we compared the group who had seen our campaign to the ones who hadn't. And we found the people who had seen our campaign had fewer women diagnosed at stage 4, which was really good. So now we're doing more research to understand the connection between women getting diagnosed earlier and our education approach, which is really great. And in places like Nigeria, where half of women are diagnosed at stage 4, and they don't have a screening program available where they can just go and get their mammogram every year, being able to recognize symptoms and report them is super important. So we do a lot of work in developing countries. So this is a map showing you where breast cancer mortality is the highest. So pink is the highest, and then it's orange, and then yellow, and then green, then blue. But that gives you an idea of where things are quite high for mortality. If I showed you the map of where breast cancer occurs the most in the world, it's going to be developed countries. But we have access to treatment and screening, which reduces the number of deaths. So more women are impacted with breast cancer, but more in developed nations, but more women die from breast cancer in other countries. But you can see on the map that we've got Belgium, which is pink, and they have a great health system and a lot of people are diagnosed. But it's just the number of people diagnosed is so high for such a small country. So do
we know why?
No.
It's just too many factors.
Yeah.
Wow.
And in some places where the problem doesn't seem so big, some of that is because maybe they will die from something else before they die from their breast cancer. Getting diagnosed with cancer can just be difficult in some of these countries to actually get a diagnosis to say, yes, this is what's happening with you. Records that indicate reasons for death can also be difficult. So, in some parts of the world, health data is very good and shared, and in other places it's not as easy to understand the problem. And in Nigeria, lemons are green. So we adjust our campaign in Nigeria, it looks like this. And to better represent women of color, we change our female figures on the materials, which is interesting. So in a study we did in Nigeria, we found that 96% of women feel confident in being able to recognize a sign of breast cancer after they do the Know Your Lemons class. 98% say that they'll go to a doctor if they see a possible symptom. 92% say they'll share it with family or friends. And their understanding of what a cancerous lump feels like went from 27% to 70%, which was really good. So we're showing that we're making a huge difference with our Know Your Lemons classes. And then this is one of our Know Your Lemons educators. So she's a volunteer. What we do is we train people online to become Know Your Lemons educators. You don't have to have any health background. We start at the very beginning with you. And she was from Kenya. She was an orphan. And then her and her sister were able to go to the Netherlands for school. So she lives in the Netherlands now, but every summer she goes back to Kenya. And she's one of our educators. So she goes and teaches classes in the villages that she's from. So this is a group of 40 women entrepreneurs in Kenya. And you can see her there with the posters. And she taught them the signs of breast cancer and how to do self-exams. And 3 women at the end of the class came to her and said, hey, I've noticed I have a symptom of breast cancer. So she helped them understand where they could go to get their symptom investigated. And all 3 were diagnosed with breast cancer because of this one class. So you can see why it's just so important that we educate and give women a chance to advocate for themselves. And we have Know Your Lemons educators in 39 countries. So this is Dawn in the UK teaching a class. She was amazing. She would this is at the equivalent of the DMV in Wales. And she'd say, I want to do Know Your Lemons classes with everyone who works here. And in England, the DMV for all of the UK is located in one place. So they have about 1,000 employees. And she did 13 classes over 2 days. And one woman got diagnosed with breast cancer because of her class. And the story of Dawn is that she had a symptom of breast cancer. She went to her doctor, her family doctor, who said, "You're young, don't worry about it." And then it got worse. And she went back a couple months later and said, "I need tested." And they're like, "Okay, well, we'll put you on the list." And she wasn't put on the immediate test. By the time she was diagnosed, it was stage 3, but she had an aggressive form of cancer that was really difficult to treat. And so she joined us because she said, "I saw these 12 signs after I was diagnosed and realized I actually had 3 symptoms of breast cancer, but the doctor only knew about 1. So he put in her notes that she had a lump, but he didn't note the other 2 symptoms she had because the doctor didn't know that there are 12 signs of breast cancer. So we're doing work with physicians, especially family doctors, because they have to know everything, right? And they don't cover it in medical school. Here are the 12 signs of breast cancer. And we can teach a doctor in 60 seconds what the 12 signs of breast cancer are. So it's really great. We educate people and we work to educate doctors. So that was Dawn. She did a lot of work and she educated 5,000 people after she was diagnosed with breast cancer. And she sadly passed away in October. But she did amazing work in Wales to get people educated. And this is what our map looks like today, where we educate all over the world. So these pink people dots are educators who have been certified through our online course. And we'd love to add more dots to this map. We'd love to have someone in every state and in every country that can be teaching Know Your Lemons classes. Right now, everyone's teaching them online. Or in small family groups, whether you're able to teach 5 people or 5,000, it's all valuable because you never know who you're going to talk to that's going to say later, "You saved my life because of what I learned from you." So that's really great. And then our app, of course, is really important in helping people understand this. And if you think you found a symptom of breast cancer, you can go to the app and tap on, I think I have this, and then it will explain to you, here's how you talk to your doctor, here's what you can expect, that sort of thing that can be really helpful. And I'd love for you to help us reach everybody. So these are women in India that we taught the Know Your Lemons classes to. So the first one is to educate yourself. So you've already done that today. The next step would be to commit to doing your screening, commit to doing a self-exam, and the Know Your Lemons app can help remind you that. Can remind you when it's time to get a mammogram. You can set up a mammogram reminder in there. Even if you're not due to get a mammogram for 5 years, you could say, in 5 years' time, I want you to send me a notification that it's time for me to book my mammogram. It's so easy to do everything through the app. So really recommend it. It's free. And let other people know. A lot of people don't know about our app right now. So we're trying to spread the word that you need an app for your breasts and you should download this.
I can't say enough praise about it. It's so wonderful.
Thanks, Ramona. And then this is Jane saying, without Know Your Lemons, I would not be here, because it helped her advocate for herself to recognize she had a symptom and to say to the doctor, "No, I want to be heard and I want to be tested." So that's great. The second thing you can do is follow us on social media. The more followers we have, the more of an impact we can make. We are sharing stuff all of the time. So I'm only able to kind of tell you the basics today, but we talk about a lot of things on Instagram and Facebook. Anywhere that there is social media like Pinterest or TikTok or anything, if you go to @KnowYourLemons, we're there. So we really, advocate for you to follow us and share our images. You can also do the Know Your Lemons challenge online if you have a lemon at home. And what you do is you learn the 12 signs of breast cancer, and then you bite a lemon for 12 seconds on video to raise awareness that there are 12 signs of breast cancer, that there is more than a lump.
and then donate $12 or more to Know Your Lemons to fund our work, and then tag a friend to say, I now challenge you to learn that there are 12 signs of breast cancer by downloading the app, and then doing this and tagging more people. It's just a fun way to kind of educate and make people aware of there's more than a lump.
Right. We will encourage all our students to do that.
Great.
Know Your Lemons challenge.
And then Amanda said it was because of a friend that shared the picture on Facebook that she was able to recognize she had a symptom of breast cancer. And it was actually 2 years later. So a friend shared the picture. 2 years later, she noticed a change, and she thought back to that picture of the lemons because it was so memorable to her. And she went, I have this. And she says, I knew then I had breast cancer, and I went in and I got the test and it was confirmed. So she's like, it saved my life because my friend shared this picture on Facebook. So please do that. The third thing is that you can donate. It takes money for us to teach these classes, to train educators, to make tools available. So any amount you can give is really good. It costs us about $1 to educate a person. And then we have education kits that we send to the educators, and kind of show you really quickly what it looks like. So for educators that can't do things over Zoom like this, like maybe they're teaching in a place where electricity is not that accessible, we have this large flip chart kit that has posters and games and all kinds of things in it so that they can do these fun interactive classes with people. And it works in any language because we just use pictures. So they can teach in any language. So $250 helps us send the kits, pay for the kits, that sort of thing. Right now we have some doctors that we're training in Burundi, Africa. It's a small country kind of next to Kenya in the middle. And just to send them a kit is $125 just to mail it. So, $250 can help us send these kits to Burundi, which is great. And then training an educator costs us about $500, and developing the course and monitoring and all the volunteer work and everything. And then help us expand to a new language would be a large donation, like $5,000. But that just kind of gives you an idea of like what things cost and how money can be allocated for things. And this is Jessica in France that said that, it helped her so much. And then the last one is to join us. So if you'd love to volunteer as an educator, we'd love to have you. Maybe you speak another language and you'd like to help proof some of our materials. So we work with professional translators to translate the work, but we always are looking for people who are native speakers to review what we've done to make sure that it's absolutely precise. And if you'd like for one of our educators to come and teach you a class, maybe you have a group, it could be a church group, it could be, work, it could be any kind of group you belong to, we'd love to do a class for you as well. So please let us know. And then the very last thing, and this is one of our educators in Bermuda with the kit that she's using it in her lovely lemon skirt. And the last thing is please fill out this form. If you go to knowyourlemons.com/student, it just asks you a couple of quick questions to understand what your experience was like today in the class. And then you will get an email with a $5 coupon for filling it out for the Know Your Lemons shop. So please do that. It's at knowyourlemons.com/student. And now I would love to hear your questions.
Oh, Corinne, I'm just blown away. Oh my goodness, what a thrill that's been. Thank you so much. Who knows who was here today that heard this, who could be directly impacted like some of these women you've given as an example, or who's going to pass this information on to someone who's going to be directly and maybe even immediately impacted. This truly is life-saving. Emily, do we have questions? And Corinne, do you have time for?
We have lots. So I want to know your time, Corinne, because you've already given us a lot of your time. And we're so grateful.
Oh, are we at 11:30 already?
We are. So you probably need to go. Is there a way that we can get you some of our questions? Because we did get a lot.
Let me pass off my meeting to somebody else really quick, and because I'd love to be able to stay and answer these questions. So just questions.
That's awesome.
Message them and say, hey.
Yeah.
So everyone let me talk for a minute that,
okay.
I hope you appreciate everybody. I know you do, but you saw that there are educators all over the world, and we have the originator with us. This is really precious time. But I do want you to consider, as a WifeSaver and part of the WifeSavers course and community. And by the way, if you're not a member of the WifeSavers course and community, I invite you with all my heart to join us. This is the kind of live events that we have a lot of. We have a variety of live events. Some of these involve guests. Some of them involve the team answering questions and creating that real bonding and sense of community where you're face to face with one another, right? Like this in Zoom. We also have events where I get to answer your questions directly about your womanhood, about your marriage, and about relationships in general. It's incredibly valuable as a community. The course is incredibly invaluable in that, as Emily mentioned, there's 100 lessons in there, and you build line upon line, and you learn skill upon skill, principle upon principle, and it's truly beloved by women worldwide. And it's just an absolute thrill to get an email from one of my students that says, I just finished the course. And they feel like a whole new woman with a completely new inside and outside, and a completely different future and a completely different past in how they actually look at or view the past. And of course, we want you to have a rather, if you want to put it this way, completely new relationship with your husband. So that's what the WifeSavers course and community is all about. And we'd love for you to be a part of our sisterhood. All right. So that being said, part of what we do at WifeSavers is get you excited about making a difference in the world, finding your own dream, or dazzle, we call it. And this might be it for you. If you're feeling that little buzz inside, being involved with Know Your Lemons, maybe as an educator, who knows? Think about it. Think about what you could do. This is so important to your happiness and to your future, and even to your marriage and relationships. And of course, in the community, and we talk about, and in the course, I actually teach you how to make room in your life and to recruit the support of your husband and even your children in these kind of dazzles. So it's possible. Think about it. Corinne, did you get your meeting passed off?
Give you 5 more seconds.
5 more seconds.
I was just going to add to Ramona that just hats off to Corinne. I was talking with my mom this morning about this webinar, and I was like, it's about breast cancer. I just don't know. Like, I think it's going to be good because it's Ramona picked, but like, I'm not sure. It was 100 times more than I thought it would be, with the beautiful designs and just making it so user-friendly, so accessible, and just, I think, totally underscoring the importance of this. I'm taken away with this whole campaign. I had never heard of it before, and I'm thinking, wow, everyone does need to hear about this. It's really fantastic. So, Corinne, we're just so grateful that you could share your gifts and talents with us, because it's going to save some lives. I can already tell. So thank you.
All right. I am ready for questions now.
Yeah. Okay. I'm so grateful because we've had so many come in. I'm going to try and kind of lump them into categories a little bit. No pun intended there, but there's people who haven't had the cancer yet who are saying, I have this in my family history, like Ramona, like you. Is there any research to support that there's anything I can do to prevent this? I know you talked about the risk factors. Is it as simple as just avoiding the risk factors, or is there more than that?
Right. So the risk factors really are key. But when it comes to preventing breast cancer, like, we don't have a vaccine for it.
And that would be more of like a preventative thing. So there's no way to kind of prevent it from happening to you if it is going to happen to you. How I like to talk about risk is it's kind of like tickets in a raffle. And maybe you have a higher risk. And so you've got 10 tickets in the raffle because of all these different risk factors you have. And maybe you have very low risk and you only have one ticket in the raffle. But when a ticket is drawn, it can be that one ticket or those one of 10 tickets. Does that make sense? So risk is kind of the same way. Maybe you've got more tickets in the raffle, but that doesn't necessarily mean you'll still get diagnosed. But having very few tickets in the raffle doesn't mean you can't get diagnosed. So that's kind of a little bit how risk works. So the main thing is to do those things so that you're aware of things and then you can get diagnosed as early as possible. There are some cancers that grow so quickly that they don't really show up until they're in a later stage. Like I said, like those skin sores is, definitely very advanced breast cancer. So some symptoms can be early stage. It's just going to kind of change for everybody. So the main thing is a mammogram can find a lump before the symptoms show up. But if you start to notice symptoms, then that's really smart to report them as soon as you can. And to not panic. That's the other thing. This is just about taking charge of your health. And
yeah, a lot of the statistics you gave us were alarming, but a lot of them were comforting. Like 80% of biopsies are nothing.
Yeah.
Yeah. Interesting. Okay.
Emily, you're on mute.
Super helpful. Thank you. Super helpful. And then on the flip side of that, so somebody who has had cancer, they found it, they've taken care of it, but they feel that increased risk because it's been there. So we had different people who said, what do we do after it's reoccurred? What do we do when, we've had it, treated it, and we're still nervous about it? Those kinds of questions.
Right. Absolutely. So it's really normal to be nervous about it. And that any little change anywhere in your body, you're immediately going to have those concerns of is this a sign of something sinister, right? So the main thing is to talk to your physician and make sure that you have a good relationship with your physician where you feel heard, that you feel like you can share your concerns, that those concerns are going to be accepted and that something can be done by those concerns. So if you don't have that kind of relationship with your doctor, if possible, find another doctor who you can have that relationship with. So that's really key. You should also have a surveillance plan set up by your physician saying this is how often we will be doing different tests. So, make sure you understand what that surveillance plan is and that you understand, why are we doing the test this often and that sort of thing can be really helpful. So some other work that I've done in helping patients understand their diagnosis, we've not talked about that today, but part of my research in that was pretending that I had been diagnosed with metastatic breast cancer, and I talked to 6 different oncologists. And it was so fascinating to do that role play with 6 different oncologists and realize how different they were. And what feedback that gave me was being able to kind of interview 6 oncologists. I thought, okay, if I got breast cancer, I know I would want that one because of the way that we were able to talk and how I felt heard and that sort of thing. So if you don't feel like you've got a good relationship with your doctor, you're not committed. So, and it's okay to get a second opinion as well. In fact, we really encourage second opinions because if you're told the same thing by 2 people, that can just give you a lot of reassurance, right?
Right.
And then if you get a second opinion and maybe the other thing the other doctor says makes more sense to you, then that can be helpful too. So sometimes it's just you have a physician that has better communication skills. That can be helpful. But yeah, really all you can do is surveillance and communicate and make sure that you feel heard. That's the main thing.
Okay, thank you. Let's talk a little bit about tests. You went over, the importance of the mammogram, the potential of the ultrasound maybe, or the MRI if we need further investigation. There's been some different questions that have come in. Like, for example, if mammograms, I have denser breasts, mammograms are super painful. Should I just go right to the ultrasound? Can I ask for that? Or the MRI or something else instead? Or in the similar vein, I have concerns about exposures with mammogram or something. I'd like to try something alternative like thermography or ultrasound instead. Talk to us just a little bit about preference versus what you're allowed to do usually with doctors. And if people have pain or other things, what do you suggest?
Yeah, that's great. Great question. So there's a reason why things are done in a certain order. And it's because those are the ways that work the best, right? And then there's also some influence there with insurance companies. If you're in the US, right, they also want things done in certain orders as well. So I would say trust the reason for the order of things. Trust that there's a reason why mammograms are done first, then ultrasounds are done as a follow-up. Like trust that. But if you do have extremely dense breasts, again, you need to be able to have a conversation where you feel heard and that you can understand, is this going to be effective for me or not? And then you can talk to ultrasounds. And if your doctor is not the kind of doctor that is hearing you or anything like that, then you're welcome to go to another doctor. Thermography is a good question. Thermography doesn't have a lot of evidence showing that it's useful in finding breast cancer. Mammograms are imperfect tools, but they are the absolute best one that we have. Thermography has been studied a lot since the 70s when it first came out. So there's no shortage of research on thermography. So it sounds new to us because it's becoming more popular. We do have a breast health educator that does thermography, and she's still very clear with her patients, you need mammograms. Mammograms are really important. So for some women, doing thermography might be just seen as, I feel like I'm doing a little something extra for me. And it's like a psychological benefit that you're getting from that. But it shouldn't replace mammograms. Also, concern about exposure to x-rays with mammograms. The benefits far outweigh the risks, kind of like exposure that you get on a long haul flight on an airplane, right? You're exposed to radiation when you fly. Yes, there is some exposure there. Newer mammogram machines use less radiation than they did before. So this is like a problem that's just going to get smaller and smaller and smaller as we go along. Does that make sense? So some of these concerns maybe with radiation to the breast are maybe 20 years old. And you think about, do you use any phones that you had 20 years ago? No, right? Technology advances really quickly. But again, it's up to you. If you really feel like that's a huge problem for you, then that's what you can do with your body. But we strongly recommend mammograms because they can find a lump before they can be felt. The other thing to know about a mammogram is the more mammograms you get and your breasts change throughout your life, the more differences will start to be visible because there'll be more to compare to. So you're kind of building this library of breast pictures, right? So the more mammograms you get, the more likely you will be to be called in for something. So knowing that, you can go, oh, well, this is my 6th mammogram and I'm getting called back for something. That's actually pretty likely because it's going to be easier for them to spot changes. So I'll go in for the ultrasound. Chances are things will be probably okay, right? Knowing that's how that works is helpful. What we've seen some medical bodies do, like for instance with self-exam, is they'll say they recommend that women don't do self-exams because they're like, it's not going to make a difference. You're not very well educated in how to do them. And it's just going to cause you unnecessary worry. We actually see this as a kind of feminist issue because they don't tell men.
That's what I was thinking.
Not to check themselves because of anxiety issues. But we see cited in a lot of journals is that we don't want to recommend self-exam because it's going to cause anxiety. It's like, no, explain to them what's in their breast, explain to them what they should be feeling for, explain that things are normal, explain not to panic, that sort of thing is really helpful. So they don't recommend self-exam a lot of times, medical bodies. The reason for that being is that medical institutions can only recommend things that show that a group of people benefit by doing them. Mm-hmm. And so they say that there's not really a difference in the number of women dying from breast cancer that do mammograms, that do self-exams or do not do self-exams. But you don't know which one person in that group is going to benefit. Self-exam is free, so it doesn't cost anything. And we are women that can handle.
Exactly.
We can give birth to babies. I think we can handle the anxiety of a lump in our breast, right?
Right.
If we know what to do about those lumps, how to have those conversations with the doctor, that's how we reduce anxiety. We don't say, don't touch your breasts. Trust a test, right? Like we should know our bodies.
Right.
So that's where we sit with self-exam, is that this is about women understanding their health and being able to advocate for themselves, because time and time again, we get these stories from women saying, I found this and I reported it. And because I did, it changed everything. So,
amen. Doesn't that fit perfect with everything WifeSavers?
I'm like, I know Ramona's loving this because it's all about that place of empowerment, right? The anxiety comes when you're not empowered.
Exactly.
When you're educated and you're empowered, then yes, you'll be nervous. And yes, it's scary to think there's something that could be lethal going on in your body. But like you said, you can get support, you can get the right people, and you can face it.
Yeah. Talk to a friend. Maybe your friend can come with you to the doctor's appointment if it's really weighing on your mind, right? Like share that burden. Don't keep it to yourself and let it keep you from investigating, because it can be kind of a scary moment where you go, I think I found something. And then you go, do I dare find out what the answer to this is? We all have that moment of pause, right?
Especially if it's your first time. Yeah.
Recognize that moment of pause and go, yes, but this is the time that I call the doctor and I make the appointment and I just start there. Right. And then you kind of navigate your way through. But, breasts in society are seen as useful for one thing. But breasts are this amazing part of women's bodies that give life, that, do all kinds of things that can bring joy, right? So let's take care of them, especially when it's so common. So let's be educated and recognize breasts for what they really are.
Wow.
Yeah.
Well, I think we better wrap this up. We've used 2 hours of Corinne's precious time.
So thank you, ladies, for staying all the way through. We really appreciate your attendance and support. And Corinne, it was amazing. So much more than I even knew existed out there as far as information, support. It's just awesome. Amen.
All right. So now you all have Corinne's email, Corinne@knowyourlemons.com. You have my email, Ramona@wifesavers.org. Please, if you need any follow-up help or direction or information, don't hesitate to write to us. Thank you. And I know as soon as you get off this webinar, you're going, if you haven't done already, you're going to go right to your phone, right? And you're going to download the Know Your Lemons app. Okay. Thank you, everybody. Loves to all. Hope you're having a beautiful day above the fray. And we'll see you next time. Oh, I'm glad everybody's pouring in today. It was phenomenal. All right. Thank you, Corinne.
Thank you, everyone.
Thank you, Emily. And thank you, Lucretia. See y'all next time.